all of you are very hungry already. So I think all of you know that there's thousands and hundreds of NSAID and painkillers, and also antipsychotic, neurotic, etc. Still, why are so many patients suffering from chronic pain, cancer pain, that's journaling for help? So I think we need some change or reform. So already there are many people asking it's time for reform. So you can see that pain management is very important because inadequately managed pain can lead to adverse physical and psychological patient outcomes. And unrelieved pain can suppress the immune system and poor wound healing also. So pain is a multi-dimensional phenomenon. So nowadays, around the world, we know that pain clinics, they use the multi-disciplinary approach, including a psychological approach, biofeedback, etc. But still, there are a lot of pain that is not well cared of. So you can see that all these systems, because the lack of content of teaching of traditional Chinese medicine, Indian medicines, Thai medicine, or Malay medicine, etc. So it's important that we include all these in our teaching in the curriculum, so that in the future they can be well off. So education is the core activity of all. Because I was the Pain Training Association in Taiwan, the General Secretary, so I know what is going on for so many years. So we are trying to do some change, including the case-based learning and interprofessional group problem solving and learning. So it's a very complicated way of doing things. So teach pain specialists is very important. I always promote East-West native integration, because East-West integration is not good enough, not using the Western medicine and the Chinese medicine again. I think Indian medicine, the Muslim medicine are also very important. Even native medicines is a lot of wisdom inside that we should learn from them. So you can see that in informed consent, we usually say that you can choose, but only you can choose the stick, but not the food that I want to eat. Because just like you can only choose Western medicine and no other medicines that can provide to you. Because most doctors don't understand about Chinese medicine, about Indian medicine, or other medicines. So it's actually unfair to our patient too. So you can see that all are disagreeing with each other. So it's important that we learn more, so that in the future we can provide more choice for our patient. So I think we can understand very well that you have more tools, then you can help your patient more. And you yourself will learn different kung fu, then you have more ability to help your patient too. So like the chess, we know that different rules ask you to how to play different chess, but you know that there's so many different chess, even the Malay chess also. So our body is just like the chessboard. You don't care what kind of Western medicine or Chinese medicine, etc. you are doing. The important is that you take care of the chessboard itself. So it's what is said about like this: begin with the patient, continue with the patient, and end with the patient. So it's much more important to know that what sort of patient has the disease and what sort of disease the patient has. It's just like the chessboards and the rules that you are using. So just like you're hungry now. So hungry is a disease, it's a food. The food that is curing the disease. But afterwards, maybe you have different choice. But in Western medicine, we only have a stick to have. But Japanese love the uncooked one. I was born in Malaysia, I like the curry. So we have our own choice. So it is important of East-West native integration. So usually when you have low back pain, you go to see doctors, you have x-ray, if not then you have CT, MRI, only looking at the bone and nerve some of the time. But you are not looking as what you say a holistic care. You never see a whole person. That's incorrect. So East-West native integration is the real global future medicines. For example, the Thai Buddhism, our Indian friend in Malaysia, they love doing this, and also the Chinese. So you don't prescribe the NSAID for them, it's not necessary. So and also not needed. So non-pharmacological therapy including an East-West native integrated medicine and multidisciplinary approach should be teach to our pain specialists. You see, the acute pain and chronic pain is different. In acute pain after operation, because I'm an anesthesiologist myself, we will prescribe the morphine for the patient. It's good. But for chronic pain, when we prescribe morphine, just like United States now, they have induced a lot of these drug abuse, addiction. So you are getting a lot of problems. In Taiwan also, because I am responsible to take care of those who are already addicted, because the doctors keep on prescribing morphine for them. And then we come to your clinic, they say the other doctor will not prescribe the morphine for me. So they got these problems are caused by doctors because they don't know how to tackle the chronic pain. So they keep on giving morphine. So harmonizing the traditional Chinese medicine and modern medicine is very important. This was written by Dr. Kaki Hui in UCLA. So you see that we are just like the blind people touching the elephant. So each will say that I know all about the elephant, but actually we just know only one part of it. So if you want to really know your body or know the Chinese word, it's important you learn how East-West native integrated method. So previously when I teach in UCLA about different East-West integration methods. So you will say that in America also, although they are so advanced in their medical system, still there is a lot of pain that cannot be solved. So when we have that in workshop, a lot of these neurologists or cardiologists, they bring their patient there, hoping that using an East-West integrated method to solve their patient problem. So in Norway also the same thing. For example, now you have knee pain. Most of you will hear that the orthopedic surgeon will say that you need an arthroscope on the knee and see what's inside there, or you need a PRP. But actually, all these are nothing to do with your knee pain. When you are going up the stair or going down the stair, you have a pain. It's actually the muscle that carry you up and down. The bones is a dead thing. Just like the puppet show, you need a string to move the woods. Thus, you need the muscles to move the bone up and down. So it's nothing to relate to the degeneration of the disc. For example, after the total knee replacement, you still have the pain. What you do? Do you have another knee replacement? No need. You just to tackle or needle the muscles. Then you will help the patient to solve the problem and not prescribing morphine for the patient. So I did the teaching in Beijing, China also. You can see that 10 over countries from Europe, they come here to learn different kind of East-West integrated method so that they can have all these Western trained doctors. So our own Taiwan native doctors or witch doctors also are neglected. So I work with them and find that actually, for example, this lady got headache, and after consultation with the witch doctors, they say that, oh, you have some problem with your ancestor. After that, the headaches were gone. So why you need a Panadol? So we can treat. Even the Indian chakra, as you know, we only know about the 7 chakra, but we don't know that there are many minor chakra with different pattern that is more useful clinically. So we use all these integrated in our clinic. So we always think that Western medicine is much better than Chinese medicine. For example, this girl, after the spinal cord tumor operation, he cannot move the leg, even cannot raise like this. So only 16 years old. So I do the scalp punctures for her. You can see that starting cannot walk properly, but later on she can walk after the third treatment. She's in the university. This also after the nerve transplantation, still cannot raise the hand. So I use the scalp punctures and she can throw the thing so far away. So actually, only a few needles can do much better than the so sophisticated and fancy operation. Just like after a stroke, you can help the patient to stand up. And also, for example, the stroke of the eye, the patient cannot see and we help them to do this. So in autism and also the brain development of the child, you can find that the research shows that corpus callosum is a hyperactivity. When they grow old, they become hyperactivity. So we need to find new scalp puncture point for treating this patient. So I have a lot of these little patients, even half the brain already operated and taken away, we still can help the patient to improve again. For example, as anesthesiologists, we also have usual quarrel with the orthopedic surgeon or other neurosurgeon. For example, severe low back pain, and then the patient has more severe aortic stenotic problem, so they have sudden death. So our colleague reject the operation. So after a few quarters, they decide. So ask the patient for acupuncture. So I did the acupuncture. You see the heart so severe, and the patient was quite happy, and she said that she will cook for me. So this also after breast cancer and thoracic spine metastasis, and they need to check where is the metastasis. They need to do the MRI. But the patient after 2 times of morphine still cannot lie down. So I give the acupunctures for the patient, so the patient can lie down and they can do the MRI, so they can do the following treatment. So not necessary that Western medicine is always better than the traditional one. So we need to give them a new education system, an integrated one, and not only to the doctors, to the system, to the public, and that's why I keep on telling whenever I have the chance that we need to promote East-West integrated way, so that the native especially, they are losing, because after the elderly pass away, then all the important knowledge will lost. For example, now you want to go to a jungle and to find a plant that can treat certain disease. It's so difficult. But if you learn from the native people, they say that certain plant can help in certain disease. You just need the Western way of clinical trial analysis, then you can help a lot of people. So I think this is my own concept. Thank you.
Any question or comments? Already now 12:35. One more presenter. Okay, no question? Okay. Thank you very much.